When I was younger, my father was diagnosed with pancreatic cancer. And the manner in which he was told essentially was very matter of fact, took away all hope for him, and didn't really give him any options. Something like that really impacted me to go into working with lung cancer screening and lung nodule management, because I'm able to be at the forefront of diagnosis of a cancer, finding something early and being able to prevent poor outcomes because we're finding it early enough where it is treatable, where it is curable. So I work in pulmonary medicine, and specifically within pulmonary medicine, I work with lung nodule management and lung cancer screening. So I am seeing patients who are coming in because they've had a CAT scan done at an emergency department or after an accident, and they find a spot in their lung. Or I'm sometimes seeing patients who have high risks for lung cancer, and they're coming in to screen and detect for nodules in the lungs that could potentially be concerning for cancer. So the most important thing for me when I see patients is to help them to gain an understanding of their condition, understanding all the aspects of their health and their background that could be risk factors for a nodule being cancer, and also really educating the patient on what a nodule could be, because it could be many things outside of being a lung cancer, and to help them understanding what we do for follow-up and what the next steps are. It's helping them to understand the different options we have for treatment, why sometimes a nodule may not need any kind of treatment or testing, and what could happen when we see changes with a lung nodule. If we find a nodule that's smaller and that nodule doesn't have any changes, I may only see them for a year or 2 years. For patients who come to me for screening, I often am seeing that patient for 15 years or longer, kind of going through that whole journey with them, working with them with smoking cessation if they're still a cigarette smoker, following their nodules over time, making sure that they're not changing in any way, and also kind of going through the journey of treatment if a nodule does turn out to be cancer. Even after a diagnosis of lung cancer and surgical resection and cure of that lung cancer, I'm seeing them for follow-up imaging to ensure that there's no recurrence of the cancer. I love being able to tell a patient that despite what we have found, there is hope. There is going to be, another chapter to your book.